My name is Nicole Cusine. I am an associate professor of clinical pediatrics at Weill Cornell Medicine in New York City. I am a pediatric hematologist oncologist, so I see children with a wide variety of hematologic conditions, but I have a special clinical and research interest in both myeloproliferative neoplasms and thrombosis in children. MPNs in children, in some ways, are very similar to MPNs in adults. They get thrombosis fairly frequently, in fact. I think the most challenging thing in making an MPN diagnosis in a small child is remembering that they happen. And in pediatrics, we like to say that children are not little adults. So there are a lot of things about kids that are different, including their normal blood counts, including their cellularity and their bone marrow. So things that may fit a diagnosis for an adult may not work for a child. So I think there's some unique features about diagnosing an MPN in a child. I think there's a few different challenges for the youngest MPN patients. I think one of them is that it's rare. So your doctor, even if they're a wonderful pediatric hematologist, might have very little experience with pediatric MPNs. I think there's not a lot of literature out there, and so when you go to the internet, a lot of what you read will be about 60 and 70 and 80-year-olds, which is, I think, very scary for parents. And I think because they're rare, most young kids and most families have never met someone else their age with an MPN. So you have this very rare disease. Your symptoms can be very varied, and it can be very isolating for those families and those kids. Even though MPNs are rare in childhood, they do happen, and we're seeing more and more of them. And I think just because something is rare doesn't mean it's not important, because if you're the parent of that 7-year-old with polycythemia vera, it's the most important thing. So I think the fact that ongoing research is happening in the pediatric field is important and exciting. And I think people need to recognize these diseases, and physicians need to be aware so that these kids get diagnosed early and get the best care possible.